Morning, everyone. Thank you for joining us for Myth versus Facts with Chriselle. She's one of our registered nurses. She's a certified diabetes educator, and have a fun next 30 minutes. Chriselle, it's for you.
Hi everyone. So just like what Celia said, my name is Chriselle and I'm a registered nurse, a certified diabetes educator here in Ontario. And today I'm going to be presenting the myths versus facts about diabetes. So I will actually start sharing my screen here, and Celia will hopefully let me know if everything is okay. So basically today we're going to be talking about, some of the common misconceptions about diabetes. And there's a lot of information out there. And the thing is, we do want to make sure that you have the right information, because what you see in Facebook or Instagram, or maybe just somewhere on YouTube, may not really be the most accurate thing. So today we're going to bust some of those myths, and then we're going to figure out if they're myths and versus facts. What I would like to do though is I would actually like for you guys to tell me what you think of the following sort of statement first, and then let's see how it actually compares to the actual answer that I'm going to give today. So let's get started. All right. So my first sort of statement here is type 2 diabetes can often be a silent disease and have no signs or symptoms. Now, if you guys can actually put in the chat whether whether you think this is a myth or a fact, or if you're not sure, that's okay too. It's because I know some of you here just want some answers. I'm going to give you a few seconds to kind of think about it while you put that in the chat, and then Celia will let me know what people's answers are. Alrighty. Do we have anything, Celia? Anyone taking a guess?
Yes, we do. It's actually half and half between fact and myth.
Oh, I love that. I love that, like some people are not really sure, but let's see what it is. It is a fact. So, type 2 diabetes can often be a silent disease. So, I'm not sure if you guys are aware of the regular blood sugar targets that we're aiming for, but for people with type 2 diabetes specifically, we would want their sugars to be between 4 and 7 when they wake up in the morning, and then between 5 to 10, 2 hours after eating. Now, mind you, I had a client in the past where her sugars were 29 and she had no idea that anything was going on. I asked her, what do you think your sugars are like today? She told me she feels great. We checked her sugar in my office at that time, and her sugar was 29. And we even washed her hands just to make sure she doesn't have any leftover sort of like juices in her fingers. And we tested again, and it was 29. So it just goes to show that just because you feel fine, it doesn't necessarily mean everything is okay. And I think that's why it's so difficult for a lot of people to manage diabetes, is because when you feel fine, you think that everything is fine. But type 2 diabetes can often be a silent disease. Now, with that said, there can be symptoms of low blood sugars and high blood sugars as well. So, if you are on medications that can cause a low blood sugar, you may feel symptoms of sweating, shaking, irritability, headaches. So, those are some of the symptoms of having a low sugar, especially if you are on a medication that can cause a low blood sugar, which can be like insulin, diamicron, glyburide, glycoside. But typically, this only happens if you are on those medications. If you are not on those medications, you're probably not having a low blood sugar per se, but you can still feel like this if your sugars are quite high and then you drop really fast. Now, on the other side, what we call hyperglycemia or high blood sugars, again, some people will not have any symptoms, but sometimes if your blood sugars are high enough for quite some time, you may actually feel symptoms of dry mouth, be feeling thirsty, feeling very weak, sometimes blurred vision, you're peeing a lot. So these are some of the signs to watch out for if you potentially have a high blood sugar. All right, going next. So the next one that we have is I can drink as much juice as I like because it is unsweetened. So I'm going to give you guys a few seconds, write them in the chat. Do you think this is a myth or do you think this is a fact? I'm going to count in my head for about 5 seconds or so until people write down their answers. All righty. So Celia,
Yeah,
what do we have?
everything is really anonymous. This is a myth.
Excellent. You guys are so good. Yes, absolutely. It is a myth. A lot of people actually would tell me, oh, I'm drinking, freshly squeezed juice right out from the orange. And they think that that's not going to do anything because they're getting it straight from the orange itself. But really, the reality is when you juice a fruit, what you're going to get is water and sugar from the fruit. You lose much of the fiber. Now, the nutrients are still going to be there, but you are losing out on the fiber that can actually help blunt the sugar spikes. So let's kind of take a look at this example here. This is ocean spray. It looks like white grapefruit, pure unsweetened juice. And, when you look at the label at the back, like they say, made with juice over 2 pounds of white grapefruits, no sugar added, all of this lovely stuff that a lot of people think is great. But really, when we take a look at the carbohydrate content, and this is what you're going to want to take a look at actually. So I'm going to see if I can do my pen here just so that you guys can see. There is actually 24 grams of carbohydrate in about 1 cup of this. And just to give you an idea, 15 grams of carb is the equivalent of 1 slice of bread. So if you drink 1 cup of this, you are basically drinking the equivalent carbohydrate of 2 slices of bread with just 1 cup. Okay. And then, when you think about this, like when you're squeezing, let's say juice, how you have to think about how many oranges are you actually needing to get 1 cup of juice. More often than not, you're going to need at least maybe 3, sometimes maybe 5 oranges for you to get the same amount of liquid juice of orange juice. So really, if you're drinking, juice, you're going to be eating like 3 or 5 oranges all at once. So what we normally recommend is you want to choose the fruit itself more often. Okay, so it kind of shows you here, there's about 21 grams of total carbs, 4.4 grams of fiber. So this actually brings the carbohydrate content down because of the fiber. And it's 86 calories compared to something like this, where, basically 1 serving of the juice is actually between 3 to 4 oranges. So you want to choose this less often. Okay. So, I'm not here to tell people you can never have this, but you do want to choose the fruit more often and choose the juice less often. All righty. All right, so the next one we have is no one in my family has diabetes, so I don't have to worry about getting it. So if you can put in the chat, is this a myth or a fact? And we'll give you guys a few seconds, and then Celia will let me know what the answers are.
Yes, Chriselle. 100% of people have answered myth.
All right, let's see. Yes, it is a myth. Absolutely. Yes, there is a significant genetic portion when it comes to diabetes. If you have a family history of diabetes, you do have a predisposition or you have a higher risk of getting diabetes. But genetics is not the only thing that actually determines whether you get diabetes or not, right? It's things like stress, it's things like lifestyle, it's things like your age, right? So a lot of people don't know that, but obviously as you get older, the higher risk you get of having diabetes as well. So we're going to see a lot more risk factors actually as we go along. So the next one is diabetes only affects people with obesity. Myth or a fact? And I'm going to talk about type 2 diabetes, right? We all know that type 1 diabetes, it can hit anyone regardless of your BMI, but this is specifically for type 2 diabetes. So do you think that type 2 diabetes only affects people with obesity? Myth versus fact?
Yes, Chriselle, we have many myths and
Okay. So lots of myths, I guess, right? Excellent. Yes, it's a myth. Absolutely. I don't know like what you guys have seen, but in my practice, I see people with type 2 diabetes from all walks of life, from every single color out there, and different shapes and sizes as well. So we get people, of course, who have more overweight, but I do have a lot of clients who actually have type 2 diabetes, and they're probably one of the skinniest people that I've ever seen. Case in point, I have a current client right now who has type 2 diabetes. She's only 96 pounds. She is a skinny lady, but and she's always been like that. But she has other risk factors that can actually affect her risk factor for getting type 2 diabetes. So one theory right now, actually, that and this study was just published recently. There is a theory out there where we kind of measure the sort of the subcutaneous fat versus the visceral fat, and this theory is what we call the personal fat threshold. So the personal fat threshold kind of says that all of us sort of have, this pocket of subcutaneous fat. And basically what happens is you have extra calories in your body, you have like extra, carbs or protein, whatever. Eventually all those extra calories will go into your subcutaneous fat, and it's going to kind of be stored in there, right? And then eventually the theory is what happens is if your subcutaneous fat like storage is full, then everything else that's extra will now go into your visceral fat. And the difference is your subcutaneous fat is sort of like the fat that's outside of your organs. That's like, that's what we call the belly fat. And then the visceral fat is actually the fat around your organs. And some people tend to have a bigger storage area of the subcutaneous fat or the belly fat. And then that means that, for some people, it takes a lot. Basically they can have a lot of like this belly fat before it moves on into their visceral fat. But then once it moves to their visceral fat, then that's when sort of like the diabetes comes more into play, because your liver and then your pancreas gets a lot of fat around it, and that's what causes a lot of these issues, and that's what causes diabetes for some people. Now, consequently, if you are the kind of person who don't have a lot of subcutaneous fat right over here, you don't have a lot of storage there, what happens is the fat will now go into the visceral fat. So that actually becomes a higher risk. So we find that a lot of people with South Asian descent, Asian descent, tend to have like a smaller sort of storage in their subcutaneous fat, which means that there is actually a higher risk for them getting diabetes, because they tend to store more fat in their visceral fat. So I hope that kind of makes sense, but this is actually a quite high risk. I would say this person here has a higher risk of getting diabetes than a person with this, mostly because there's not a lot of visceral fat in here and there's more subcutaneous fat. All right, so next one is you can get diabetes from eating too much sugar. Myth versus fact. Please put them in the chat, and then let's see what the answer will be. All righty, I'm going to stop there.
Well, we have few facts and
Okay.
few.
Okay. So it looks like, some people think that this is a myth. Some people think this is a fact. Let's see what it says. It is actually a myth. So again, one of the things when it comes to type 2 diabetes is it's not just one thing that's going to cause you to have diabetes. It's a lot of other things, right? There is a link, obviously, to having excessive sugar intake, and then where you can get more obesity, and then that increases your risk of getting diabetes. But sugar itself is not actually a cause of diabetes. And actually, here are some of the risk factors that we can get from, or risk factors that someone can have when it comes to type 2 diabetes. So if you have overweight or obesity, if you have had gestational diabetes in a previous pregnancy, if you have a family history of diabetes, if you have polycystic ovarian syndrome, if you are over the age of 45, if you've, for women, if you've given birth to a baby weighing over 9 pounds or 4 kilos, If you are from a high risk group, Asian, South Asian, Arab, African, Hispanic, or Indigenous descent, you are already at a higher risk, regardless of everything else that's in here. If you take corticosteroid medication, so something like prednisone or dexamethasone, can definitely increase your risk for getting type 2 diabetes. And of course, if you have a sedentary lifestyle, high processed food intake, a lot of stress, that also comes into play when it comes to getting diabetes. So, yes, sugar, in excess amounts can contribute to having type 2 diabetes, but it is not the only cause of having type 2 diabetes. All right. All right, so the next question we have is type 2 diabetes is not as serious compared to type 1 diabetes. So let's see, myth versus fact. We'll wait a few seconds.
Yes, Crystal, we have a lot of myths.
Okay, let's see. That's right. It is a myth. Absolutely. Type 2 diabetes and type 1 diabetes are both very serious diseases, right? Obviously, the only difference is that if you have type 1 diabetes, you do not make any insulin in your body at all, right? Which means that if you do not get insulin, then you will get very sick very fast. In comparison, for people with type 2 diabetes, they still make a little bit of insulin, or depending on where they are in their trajectory, because maybe some of them are still making insulin but not enough. Some of them don't make very much either, but there's still a little bit there. But at the end of the day, the complications that you can get from both type 2 and type 1 diabetes, if it's not managed, if the sugars are always high, these are the complications that you can get. So the complications are still the same. So strokes, heart attacks, you can get peripheral artery disease, retinopathy, some people blindness, glaucoma, diabetic foot issues, you get kidney issues, you get nerve issues, you even get gastroparesis. So again, regardless of whether you have type 1 or type 2 diabetes, the risks of complications are kind of the same, and the diabetes complications are still going to be the same for both. All right. So we have to take both seriously. All right. So the next one is only people with type 1 diabetes need insulin. Is this a myth or a fact? Give you guys a few seconds here.
Hi, Crystal, we have many myths.
Okay, great, excellent. And you guys are right. Yes, it is a myth. Basically, a lot of people seem to think that, oh, now I need insulin. Does that mean that I now have type 1 diabetes? And that's simply not true. Right. Again, just like what I said before, people with type 1 diabetes, they actually have an autoimmune disease, which means that their own bodies are attacking their own pancreas. And that's why they're not making their own insulin. Now, for people with type 2 diabetes, some of you may not require insulin. Some of you will eventually require insulin. Some of you are already on insulin. It does not mean that you have type 1 diabetes. It just means that you're not making enough insulin on your own, right? And I think of insulin as sort of like a supplement. If you don't have enough vitamin D, you have to take vitamin D extra, like as a supplement. So if you don't make enough insulin for what you need, then you may require insulin in that case. Mind you, not everyone will require insulin, and that really depends on the goals. That depends on sort of like you as a person. But yes, just because you have insulin does not mean that you have type 1 diabetes. And many people with type 2 diabetes will require insulin eventually. All right. There is no such thing as a special diabetic diet. Is this a myth or a fact? Let's see what we got.
Have many myths.
Okay. Oh, no, actually, it's a fact. Sorry, I think I read my question wrong. But yes, there is no such thing as a special diabetic diet. A lot of people think that they require a special kind of diet, but in reality, that's actually not the case, because what people call a diabetic diet is simply just eating healthy. All right. So, typically this is what we recommend. We recommend what I call the healthy plate. So, within the healthy plate, you would want a lot of vegetables. Now, this is actually from this is the healthy plate that we have from Health Canada right now. The only thing that I would recommend is for you guys to have half a plate right over here of non-starchy vegetables. Okay, so when we talk about non-starchy vegetables, we're talking about, your leafy greens, your broccoli, your green, like red bell peppers and stuff like that. Um, I would not add like squashes and peas. They're still great. Those can be starchy though. So if you eat enough of that, that can still be considered as a carbohydrate. So you really want to have non-starchy vegetables as the star of your plate. So you want to aim for actually half of your plate with that. You also want to aim for a quarter plate of your protein and then a quarter plate of your carbohydrate, right? So obviously things like potatoes, bread, pasta, beans, like all of that kind of stuff would be your carbohydrate. And then there's also a lot of things, it's not just what you eat, but also what else you do around it. So being mindful of your eating habits. You want to cook more often instead of going out. You want to enjoy your food and you want to have a variety of this. And you want to, they're even saying eat meals with others. You want to use your food labels so that you can actually see what's in your food. The thing is, a lot of these food manufacturers, they really trick you when it comes to, oh, this is healthy, this is good for you, try this. But the only way for you to know if this is actually going to work for you, or if what you're seeing is not just a marketing scheme, is if you actually look at the labels. You want to obviously limit the highly processed foods if you can. And again, just knowing that marketing can influence your food choices. So this is another image that I show people where you want to have, again, half of your plate non-starchy vegetables, a quarter will be your carb foods, a quarter will be your protein, and you do, or I guess we would recommend water mostly for your drinks, or a 0-calorie drink. Um, Now, the only thing is, people would be asking me, well, what about keto? What about this? Like, some people, like, I can't eat carbs because then the carbs are going to increase my sugars in general. And the thing about going on a specific food pattern is that it's so individualized, right? And just because one thing works for another person, it doesn't mean it's going to work for you. And at the end of the day, I want you guys to think about this as like you have a map. So this is what I call like a diabetes map, right? Maybe you want to get here. Maybe this is you living a healthy life, your blood sugars are maintained, you have a healthy weight, and this is where you're starting from, right? And when you think of a map, there's a lot of roads to go from point A to point B, right? So think of this as like, okay, maybe this road is sort of like the keto diet. Maybe this road is like the Atkins diet. Maybe this other road is like the higher carb, like plant-based diet or whatever. But at the end of the day, we just have to find the road that's going to work for you, right? Because again, as I said, the other roads can also lead you to the same spot. And what's going to be tricky and what's going to be important is basically taking the road that's actually going to work for you. Okay. And so typically, for someone like myself or a dietitian, we kind of work as like a navigator, if you must say. Let's say if you have a GPS, we work sort of like as a navigator for you that can help you kind of get from A to B. Of course, there's a lot of people who can experiment on their own, but some people would want more of that help, right? And then we can navigate you through the roadblocks. Maybe there are certain hurdles that you're experiencing within the road, and we can kind of help you with that. But at the end of the day, you are still the pilot, right? So we're just here as a GPS. Whether you follow us or not, that's still going to be up to you. But basically, at the end of the day, there is no best diet when it comes to diabetes. It's only the diet that's going to work for you. And I hope that sort of makes sense. All right. You don't have to eliminate foods you really like from what you eat. Is this a myth or a fact?
Hi, Crystal. I'm leaving an
Hi.
extra. seconds for people to write.
Yep.
Actually, it's half half.
Half half. Okay, half half. Let's see. All right, it is a fact. So this is correct. You don't have to eliminate foods that you really like from what you eat. Okay. And people are thinking, well, are you telling me that I have to eat pizza now? Are you telling me that I can still eat my burgers or my cake? And really, at the end of it all, it's really all about moderation, right? Especially when we're thinking about sustainability. If you're keeping yourself from eating all of these things that you really like, or you're finding yourself, you're really restricting, studies actually show that you're going to end up binging on those foods, right? If you keep on restricting yourself from like everything that you like, eventually you're going to crack, and then eventually you're just going to give in, and then you're going to be more likely to overeat, right? And really, the way we think about this is, we have all of these lovely foods. Obviously, these are more of like your whole, less processed foods, and this is more of like definitely the processed, obviously more engineered to be yummy foods. And we want to think of it as like a spectrum, right? Where you want to choose more of these foods more often, and you want to choose these foods less often. It doesn't mean you can never ever have any of this. And and the thing is, uh, when your body has diabetes, your body is not really going to function the way it is anymore. It's not going to function the way it's supposed to. It's actually virtually impossible for you to get like 100% perfect management all the time. And there is nothing wrong with having some of these once in a while and having more often, right? So we really have to strike a balance. We're still human. We want to live. Holidays are still going to happen. Holidays are coming up. There's going to be treats in there. And we really want to balance your quality of life. So just because these things are what a lot of people call off limits, it doesn't mean you can completely eliminate them. Very likely, if you're eating this a lot, we can probably work on kind of really cutting back slowly. But at the end of the day, like you can still have them. You just got to have it in moderation. And nothing is ever going to be perfect. All right. So just know that there is no way for you to completely eliminate certain things. The only caveat that I have, though, is that for some people, there are certain trigger foods. So if you are finding that you have trigger foods where once you start, you just cannot stop, that might be one other thing that that you want to think about, right? So maybe the trigger foods is something that you can avoid just because once you start, you can't stop. But it doesn't mean there's other things for you to have that you can have in moderation. All right. Now, Celia, I am just mindful of the time. Are we still okay? It's 11:30. I'm not sure if this is until 12.
It's an until now.
Okay. So basically, I think I'm going to stop here actually, because just in case people have um, any questions at this point, anything you want me to answer? I had a couple more, but because we're out of time, I won't have time to do that. So I want to be respectful of everyone's time. Does anyone have any questions? Any other myths or facts that you want me to dispel and talk about today?
Yes. So we actually have two questions.
Okay.
So how do we determine if we have visual fat is higher than subcutaneous fat?
Yeah. Honestly, the study that they did, they actually used an MRI machine to determine that. There is no way for us, without like an MRI machine. And I highly doubt that right now the doctors can actually say, okay, let's order an MRI machine for you to see how much subcutaneous fat versus visceral fat you have. It's just not something that's feasible right now. Maybe in the future, but it's right now. It's still like the research is ongoing, so we actually don't know. Unfortunately, there are certain ways, but it's still being studied.
And I have one last question,
Mhm.
which is, and it's related to the fat. How does it move from one to the other?
So it doesn't really move. It's more like I like to think of it as like, let's say you have a bathtub, right? You have a bathtub which holds like, whatever amount of water, and then you have like a little pail beside it. So what happens is, water is going to flow through, it's going to go into the bathtub, and then the excess water will then spill onto the pail, right? The only thing is some people have a bigger bathtub than others. So if you have a smaller bathtub, then that fat or the water, whatever, is going to go into the pail much quicker compared to someone who has a bigger bathtub. So yeah, and we don't know right now.
Sounds good. So to answer Jim, yes, the session is recorded. You will all be sent handouts of recap of the session. So we would like to thank you very much for your presence for today's webinar, and thank you so much for allowing us to share our knowledge. And don't forget to check your inbox for the handout, and you will also be receiving a short survey. And we look forward to seeing you connected. Have a wonderful rest of your day.
Thank you guys. Have a good day.